Dr. Arthur Ting, orthopedic surgeon, practicing for more than 30 years here in Fremont, California. We've been fortunate to have a lot of people come through the clinic, and I think as opposed to naming a list of hundreds of different athletes, I think the ones that I've actually done surgery on are, as you mentioned, Tiger Woods, here in the Bay Area, Joe Montana, Barry Bonds, Yao Ming, in the motorsports world, Kenny Roberts, Eddie Lawson, Mick Doohan, some of the most famous Moto GP racers. There's just been, as you mentioned, or previously you mentioned soccer, Landon Donovan, a lot of the other early earthquakes here locally. I've been the Sharks team physician for over 20 years, started with them. I consult with them now as an orthopedic surgeon, but most of the Sharks have been through here. Joe Thornton, Patrick Marleau, and all covering all sports too. Well, technology has taken over the whole world, not just in the medical field, but as we see, everybody's got an iPhone, what have you, but we use technology from anything from medical records in tracking patients to in the surgical suite, where I now use robotics for partial and total knee replacements. Technology, as you'll see, we tried to bring in the latest in physical therapy, rehab. I mean, it's taken over everything. Our ability to communicate, telemeds coming in, so we can keep track of our patients, whether they're here or someplace across the world, or here and in their own house. I mean, it's just making things way more efficient. Well, it just makes everything more efficient. You can communicate faster, and I actually say to med students or people that I meet, even my own patients, I go, it's not our ability to treat that's failing, curing cancer, etc. It's technology's failing us currently. So once technology catches up to everything, I think it'll be used in every phase. And like I said, the diseases like cancer, infection, aging that we feel like we can't cure at this point will be cured once the technology catches up to us. We've put in cryotherapy. It's a way of, in the tech world, a good analogy is we're basically body hacking. Okay, so we're fooling the body into thinking something bad is happening with the decrease in temperature, creating a sympathetic type of response, and therefore norepinephrine, which are the neurotransmitters, and other things. It inhibits TNF alpha. Those are markers for arthritis, but it's a way of tricking the body into thinking something is happening so that your own body mechanisms produce things that are actually helpful for it in healing and well-being. The endorphins and the neurotransmitters, those are the things that give you a sense of well-being when you get so-called addicted to exercise. Okay, so we also use blood flow restriction, another way of fooling the body into thinking that you exercised really hard without any muscle damage or joint trauma. We've made a great effort in trying to design an office that provides patients with the latest and most up-to-date type of therapy treatments. And I won't show you the surgical suite because that's the other part of my practice, surgery, but just in the office we have built this 4,000 square foot facility that includes office space, x-rays. Naturally it's orthopedics, so it's geared toward the musculoskeletal injuries and diseases. Those are the exam rooms, x-rays in here, and then physical therapy, where we talked about a lot of the different types of modalities that we use, are everywhere from, everywhere from bumps and bruises to post-operative care. These are Normatec boots used for compression, basically recovery. Removes the lactic acid mechanically. It gets rid of swelling. All the training rooms have those. Have them, Raiders, everybody uses those. This is a class 4 laser, hot. This is, technology is that it creates enhanced tissue healing through ATP, also good for scars and nerve issues. Decreases inflammation around the nerves. Let me show you the plyo plate, vibration device that basically it vibrates, so you have to use your own muscles to even stand and balance. Then I'd like to show you the latest in hot and cold therapy. So game ready, hot and cold compression. That's Cameron Marshall. Standard therapy modalities, stim and ultrasound. I'm hoping that messes it up. Hydrotherapy is the latest in thermal heat therapy, where it keeps the gel packs, which are more comfortable than the old-fashioned hydrocollator. It's hot. This is hot.
Oh, okay.
This is heat. Heat enhances blood flow. Heat helps with muscle relaxation. This again is part of the body hacking recovery theory, that you put an athlete in here for 3 minutes at a time at a temperature below, sometimes getting up to minus 180. It shocks the body into thinking something bad is happening. It triggers, it's been scientifically shown that produces norepinephrine and stimulates like growth hormone, neurotransmitters, all the endorphins. The cold itself is a modality, is an analgesic, so if you have muscle aches, things like that, it helps. Well, it gives you a sense of well-being because it stimulates the endorphins in your body. What I told you it does, it's been scientifically proven. They say you can treat everything with it. So there's a proven science part, and then there's a anecdotal part where the athletes feel better. They say when they've had multiple sclerotic patients, all cancer patients, they've felt like it's helped cure their problems, but it hasn't been proven scientifically. One of the things we had, one of the first team physios from Arsenal, and I specifically asked them what their reason was in having a cryo chamber, because they have a full body cryo chamber. And he said, besides the things that I've already mentioned, they said just showing that the athletes, that they have everything available to them, was more important than having something that specifically does something for you. So they're basically saying that they want to provide their athletes with the latest type of modalities, as long as it's not hurting them. They feel like it should be part of their treatment. So that was his rationale, which was a good reason as far as I'm concerned. So you never want to make the athlete feel like you're holding back in terms of any type of treatment. It's psychologically. It's recommended 3 minutes at a time. We've got some people that like to go in twice a day, but usually everybody's different. So we like to have them adjust how it affects them and how they recover. But some guys go in daily. Just how roomy it is, and we've tried to design this as like a training room, physical therapy room.